Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. J. Calvert here with my very, very excited and ready to rock and roll co-host, Dr. Millcent Rovelo. How are you doing?
I'm doing excellent. How are you?
I'm good. I know you're ready to rock because we've got some amazing things to talk about with Lindsay Lohan.
Lindsay Lohan is all over the news, all over
Everywhere.
the feeds right now. Girl is everywhere. To the point where they actually reached out to you personally last week from Texas to discuss Lindsay Lohan.
Yeah, I mean, they wanted to hear what I thought happened and what was done, and I think I had some good insight. I don't know. It'd be great to actually know what happened, but you and I are going to break it down in a lot more detail than I was able to in a very short segment. I think I had maybe a minute or so to kind of discuss what was going on. And I was on with Dr. Doris Day, who is an incredible dermatologist, and she had a lot of commentary about her skincare and also her health and talking about why she is glowing and looking amazing. So it was really great.
Yeah, and that's really what it is. I think across the board, everyone is looking at Lindsay right now and saying, she looks really good. She looks really great. What is she doing? And can we do that as well?
Yeah, I mean, we might as well because
inquiring minds want to know.
This is what we do.
Yeah.
Yeah, so when I looked at her kind of before and after, I thought that she has done some facial surgery. Of course, we don't know. These are just our opinions, and it's what we think might have happened. Until, she comes out and says, like, this is what I've done, like, who knows what it is.
Who's to tell?
So since I already answered this question on that news segment, why don't you tell me what you've been kind of coming up with? What do you think she's been up to?
Yeah, so as in general, I actually really dislike these conversations because, like, oh, did she have plastic surgery? Did she not? Who cares? Like,
I know, but people want to know.
But people want to know.
They do. They're looking at her going like, so what magic wand touched her face?
But then I always have to say, number one, she's older than she was when she just, in her early 20s and still had her baby face and baby fat. So that always contributes too. So people put up side by sides of like her when she's 20 and her when she's in her mid 30s. Like, of course, the face changes. With time, the face gets more angular. The bone structure does show a little bit more, especially if she's lost any kind of weight. The other thing, too, is I never know how much these photos are photoshopped and filtered. So that's the other thing, too. It's like back in, 15, 20 years ago, we weren't filtering and photoshopping all of our photos that were out there. I know everything is super filtered. So everything I'm saying here about what she may or may not have had done is very much grain of salt because, like you said, we will never know. No. But going based on purely what her face looks like now and assuming it's real and not super filtered, we can talk about what she could have potentially done to look like she does now.
I agree with you 100% about the photoshopping. As you know, we've discussed that a lot.
Yes.
So even these pictures that are showing her as like, oh my God, look at her amazing new face. Of course they're buffed, filtered, layered, like whatever you do with Photoshop to make things look amazing. With that said, you still can't do everything. So, you kind of can, but...
And if someone comes to you and says, I want to look like her in that photo, like, okay, great. So we can tell you now what kind of surgeries you would need to have to look like that, whether or not that's what she had done. So I think if let's start with kind of the big package, outside in, which is what Dr. Day referenced on the program that you were on. Her skin looks amazing. Like she is literally like has this glow and healthy tone to her skin.
Yeah, and that is, that can be from better exercise, from better diet, no drugs, no alcohol, like whatever those things, a little less partying, a little less late nights in the club.
Right.
All those things add up to looking fresher, healthier. And then also the skincare regimen has to be there too, because there are things you can do to really get your skin to perk up, look, basically more radiant, that can, get that glow, that can really help bring the blood flow to the surface. You can do some light glycolic washes, things that just on a daily basis make your skin better.
Make your skin better. These are all of the creams and the lotions, and you can do a whole esthetician, dermatology topic on this. But overall, daily good skincare that resurfaces the skin on a regular basis, doing your antioxidants, your vitamin C's, retin A's, wearing your sunscreen, sun protection. And then always, if you're going to really want to glow and keep your skin looking good, you do have to do the more invasive procedures. This is going to be regular microneedling procedures. IPL or photofacials to get the pigment out, doing some kind of light resurfacing, a Clear and Brilliant or a Pixel or a Fraxel or whatever, something to sort of take off the deeper layers of skin. All of these things are what can help contribute to that glowing, fresh-faced look. And I'm sure she's doing all in combination, of the above.
What about surgery? Do you think that she's had a mid-face lift and brow lift? Do you think she's had a lower face and neck, a deep plane facelift, a lip lift?
So surgery.
Rhinoplasty?
Let's look at her face. Let's do a top-down approach as we are taught. So, why don't you take the top half?
Well, I think she's had a very mild upper facial rejuvenation set of procedures. Probably a lateral brow, probably a mid-face, possibly a little bit of lower lid surgery, fat grafting that has really rejuvenated the upper face. And as you know, I love that operation. I think it works.
I'm a fan.
It's we have a whole podcast episode about Dr. Rovelo talking about her experience with the mid-face lift and the brow lift. And it does make people look refreshed. It makes it brightens the eyes. It makes the upper, less concealer on the lower lids, all that kind of stuff that really contributes to a look like she has. And then, I do think, I'm looking at the nose, and I think the nose has had some attention.
The nose has definitely had some attention. She's always had a cute little nose before, but this one definitely looks a little more stylized than it used to.
Yeah, I like it. I think it's a good rhinoplasty, and if that's what happened, I mean, maybe not. Maybe it just grew that way. But
Yes, that's what happens over time. Your nose gets more beautiful and more refined.
It does happen like that.
No,
it doesn't at all. It's actually very much the opposite. But yeah, what do you think about the lower face? Does she do a deep plane facelift or some kind of mini face or some sort of neck thing?
Yeah, I'm going to say probably not. I think she had maybe a little bit of a lip lift. Mm-hmm. When I look at the central part of her upper lip, she definitely seems to have a little bit more teeth show. So the teeth show is literally what it sounds like. How much of your teeth show with your lips in repose. Over time, the upper lip, which is kind of a very medical definition. Most people think of the upper lip. They just think of like the top lip, the red part. In doctor speak, the upper lip is the entirety of the skin from right below the nose to the end of the upper lip. It's
the red part. It's all of that.
That's all upper lip. And that tends to lengthen over time and with age. And so she looks like she may have had a little bit of a lift in the center there. She may have had some dental work done, but you can definitely see her teeth a lot more than you used to previously. Obviously, she has lip filler, as we all do, but in particular, I think she also had a little bit of surgical enhancement in that area as well.
We know she had dental work done because on her Instagram story was her with my dentist, Dr. John Marashi. And so I don't know what he did. Maybe he didn't, we can't say.
Maybe he just whitened her teeth.
Maybe he did veneers. Maybe he lengthened her teeth a little bit to get a little more tooth show. Who knows? But whatever it is, looks great. And that's what Marashi does. If you go on his Instagram, it's like every celebrity you can name is going
Because nobody minds calling out their celebrity dentist, but God forbid you call out your plastic surgeon.
No, I mean, Marashi has like pictures of him like doing like lightsabers with, Ewan McGregor, saying like the famous Obi-Wan Kenobi, like I've got you now. Like,
yeah.
No, if he came into our place, like
backdoor entrance, like
backdoor, like security, like make sure it's empty, like no chance.
I know, not fair. But anyways, lips, teeth are looking great. With regards to whether or not she had a lower facelift, I'm going to err with probably not. She may have had some sculpturing of her lower face, some liposuction, some more non-invasive skin tightening devices, maybe some jaw filler. My inclination would be that she probably didn't have the whole lower face done surgically, but I think she has done some sculpting of her lower face, including some liposuction, maybe some buccal fat, maybe some jaw fillers, and some skin tightening devices.
I think she has had a lower facelift.
Okay.
I was looking pretty closely at that, and I think that and it may be Photoshop.
See, that's the thing, right?
It may be. Okay, so it could be Photoshop. But I do think if the photos do represent the soft tissue distribution of her face, then she's probably had a lower face and neck, which can be done in a very mild way. That's kind of what we do.
Right.
You can do it. in a way that it's not that noticeable. For younger patients, when the patients are in their 30s and getting facelifts, they want a composite lower face. They don't want like a big skin, and SMAS lift. And just for those of you following at home, we have plenty of podcasts about SMAS and deep plane and SMAS plication and all the different terminology. So please reference those episodes. But for what I think what would happen here would be like a composite deep plane facelift, which is basically taking the skin and the underlying tissues as a unit and doing a lift. It's a very, time-honored surgery that, really has been around since the 70s when Tord Skog described it in Sweden in a textbook. Not everybody on Instagram that says they've invented the deep plane facelift in the last 2 years, which is just... I'm not going to get on the box. I know. I can feel it. I feel the box coming out of the closet and like getting over here so I can stand up on it and start talking about it. But I'm not going to do it for the Lindsay Lohan episode.
Thank you.
How's that?
I appreciate it.
Good. What else do you think she's done? Has she done some fat, any kind of fat grafting or?
I mean, maybe. I don't know. Maybe something in the temples, maybe. But if she had a mid-face lift, and just as a quick refresher, since the mid-face podcast was a while back, when you're looking at doing a lateral brow, mid-face, orbital rejuvenation, you're putting incisions in the hairline and you're dissecting down towards the cheeks, the cheekbones. You're releasing them and you're literally pulling them back up over the cheekbones into a higher position. And so it gives you more of that sculpted cheekbone look. So that's what really rejuvenates that mid-face. Then if you pull the edges of the brow up a little bit, take some skin from the upper eyelid, all of a sudden you're brightening the eye. And this is also, people have referred to this as the fox eye procedure, so she may have had a version of a fox eye procedure where you kind of change the tilt of the eyes a little bit so they slope up a little bit more. So all of those things could have potentially been done to recreate a more open, kind of exotic looking upper mid-face area. All of the above could be done together, in combination, all at the same time, separately. Whatever she did, she had really good work. Shout out to her plastic surgeon, since she probably won't shout them out. I'll give her plastic surgeon some kudos.
Well, we know her dermatologist is from Dubai, and she talks a lot about her and what she's doing there. So possibly this was done in the UAE.
Maybe.
Possibly. It may have been done in LA or New York or wherever you can find yourself a great facelift surgeon. I think the people doing a lot of these, we just had the facelift face-off at the LA Society.
Yes, which is great.
Which was awesome. And shout out to Mark Mani and to Ritu Chopra, who did a great job with that, and Dr. Orden, who was the moderator. Do you like the deep plane facelift? What do you think? Guys, let's discuss. He nailed it.
Dr. Orden.
I mean, Orden is the best. And I hope my impression did him justice. But it was really good because we went through, all these different techniques and whether you need to do plication or do a SMAS or do you even need to make the incision, the retrotragal incision, like can you do it with just the neck and then the endoscopic piece? And I think it's interesting. I mean, it's a real debate on how to get the best results for each patient. For each patient
and for what they're looking for. And her look is very natural, just better, obviously, because we're all talking about it. And I think in general, in a very positive way. I haven't really heard anybody come out and say negative things about how she's looking, which I'm sure they're out there. The trolls exist, gosh, under every nook and cranny and bridge. Haters. But in general, I think the overall reaction is that she's looking great. She's looking like a great, best version of herself. Yeah. So whatever she did, whoever did it, good job.
And hopefully it inspires other patients to understand that, if you find a good plastic surgeon, you can get really nice plastic surgery that not only makes you look awesome, but doesn't make you look like you've done anything.
Yeah, that
you don't
actually
have to look done.
People can actually wonder, as we are, did she not? Did she? We don't know. There's some people, and we all know who those would be, where you're like, oh yeah, she had some work done. But when you're left wondering, that's good. That's a good plastic surgeon.
And it should be inspiring to people because I think, whatever it is she did, she looks awesome.
Yes.
So once again, to quote Sophia Loren, find a great plastic surgeon and get old with them and they will take care of you the right way.
1,000%.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.